The blood vessels are the organs of the cardiovascular system that make sure blood gets distributed to all parts of the body. We're going to look at just a few blood vessel locations. The arteries are the blood vessels that take blood away from the heart. The aorta is the largest, and this is the one that originates from the left ventricle. As the aorta leaves the left ventricle, it proceeds upward. This is known as the ascending aorta, and this is the part that the right and left coronary arteries come from. It then arches toward the back. This is called the aortic arch. There are three blood vessels that come off of the aortic arch. The brachiocephalic artery comes off first. It immediately branches to the right subclavian artery and the right carotid artery. Then the left carotid artery comes off and the left subclavian artery. The carotid arteries are going to take blood to the head and neck region. The subclavian arteries go to each arm, and as we travel down the subclavian arteries and get into the upper arm, we call it the brachial artery. The aorta descends through the thoracic cavity where it's known as the descending thoracic aorta, and then as it goes through the diaphragm, it becomes the descending abdominal aorta. Coming off of the abdominal aorta, we have the celiac trunk. This branches to arteries that feed the stomach, the spleen, and the liver. The mesenteric arteries feed the large and the small intestine. We have an inferior and a superior mesenteric artery. The renal arteries go to the kidneys, and the aorta branches at the bottom to become the iliac arteries. These branch into blood vessels that go to the pelvis and the legs. Immediately coming off of the heart is the ascending aorta. The right and left coronary arteries emerge from this. The aortic arch is where the aorta arches to go back toward the back of the body. There are three blood vessels that come off of the aortic arch. The first one is the brachiocephalic artery, and this one is going to branch immediately. It branches into the right carotid, and then the left carotid comes directly off of the arch. The right subclavian artery branches from the brachiocephalic. The left subclavian artery comes directly off of the aortic arch. As we move down the arm, the subclavian artery becomes known as the brachial artery. This happens on both sides of the body. This would be the descending thoracic aorta. Once we go through the diaphragm, we have the descending abdominal aorta. The celiac artery comes off and is a single artery that branches to go to the stomach, liver, and spleen. Just under the celiac artery, we have the superior mesenteric artery. It's going to branch and go to the upper part of the large intestine and most of the small intestine. As we come on down a little further, we have the inferior mesenteric artery, and this goes into branches that feeds the lower part of the large intestine. The aorta will branch, becoming the right and left iliac arteries that will head toward the legs. The descending aorta, the abdominal aorta. Here's the celiac artery. We've cut away the intestines. Here's the superior mesenteric artery. Here's the inferior mesenteric artery. The renal arteries come off of the abdominal aorta to go to each kidney. And then we have the iliac arteries. To look at a few of the arteries again, the carotid arteries go to the head and neck. The subclavian arteries go to the arms. We have the brachial artery in each arm in the brachial region of the body. The descending aorta, we have a thoracic above the diaphragm and an abdominal below the diaphragm. You can see the renal arteries here. Here are the iliac arteries, and once the iliac arteries leave the body cavity, they become the femoral arteries. The veins are going to collect blood from capillary beds and return blood back to the heart. The superior and inferior vena cava both enter the right atrium. The superior vena cava will collect blood from the head and neck and the arms. The jugular vein will drain blood from the brain, the subclavian vein from the arm, and we will have two brachiocephalic veins when the jugular and the subclavian veins merge. The inferior vena cava brings blood back from the lower body. We also have some superficial veins. The great saphenous vein is a superficial vein that's found in the leg. It's one of the longest veins in your body. The common iliac vein will drain blood from the leg and the pelvis. The renal veins will drain blood from the kidneys, and the hepatic veins will drain blood from the liver. The jugular veins come down from the head and neck, and the subclavian veins come in from the arm. On both sides of the body, the jugular and the subclavian veins merge to make the two brachiocephalic veins. These two veins merge to make the superior vena cava, which will return blood to the right atrium of the heart. The iliac veins will return blood from the legs. They will merge to form the inferior vena cava. The renal veins will drain into the inferior vena cava, and there are several veins that drain the liver that drain directly into the inferior vena cava. This too will take blood back to the right atrium of the heart. We have the iliac vein coming back from the leg, but this great saphenous vein is a superficial vein. Here is the deep femoral vein that's returning blood from the deep tissue, but we have a number of superficial veins. You see these on the back of your hand, the top of your foot, but this great saphenous vein runs the entire length of your leg. This is the vein they will harvest when they want to do bypass surgery if they want to use real blood vessel tissue to make those bypasses on the heart. Looking at a few of the veins, we have the jugular veins coming back from the head and neck, and the subclavian veins coming back from the arms. They merge to make the brachiocephalic vein. They merge to form the brachiocephalic vein, which merges to make the superior vena cava. The great saphenous vein, one of the superficial veins in the leg, eventually joins the iliac vein. The iliac veins merge to make the inferior vena cava. The fetus has a slightly different circulatory arrangement. The fetal lungs, the urinary system, and the digestive system in the fetus are not functional. The placenta acts as the organ of exchange for the fetus for oxygen, carbon dioxide, nutrients, and waste products. The maternal and fetal blood do not mix in the placenta, but they do come very close together. This allows for the diffusion of nutrients, wastes, and gases to occur in the placenta. The blood is then carried from the placenta to the fetus in the umbilical vein and away from the fetus in two umbilical arteries. The nutrient-rich blood is in the umbilical vein. Now, as this vein enters the fetus, it becomes the ductus venosus, and this blood is carried directly to the right atrium. We don't really have to send blood to the lungs. The lungs are not functional, and we're already carrying oxygen from the mother. So most of the blood goes from the right atrium to the left atrium through a hole in the heart known as the foramen ovale. When this heals up, you're left with the fossa ovalis. Blood that does not go to the left atrium will go into the right ventricle and enter the pulmonary trunk. There we have a blood vessel attached to the aorta. This is known as the ductus arteriosus, and blood entering the pulmonary trunk will actually go into the aorta through this. Just a little bit of blood will travel to the lungs to make sure those blood vessels are developing appropriately. Looking at fetal circulation, the placenta is the organ of exchange. We have the umbilical vein carrying blood into the fetus, and it will become the ductus venosus once it enters the fetus. This will go to the right atrium, and a lot of the blood will just go through the foramen ovale from the right atrium to the left atrium. Blood that does get to the right ventricle and into the pulmonary trunk will go to the aorta through the ductus arteriosus. Most of the blood circulates directly to the fetus. Very little goes to the lungs. Once it is circulated, the blood is collected in the umbilical arteries, which will carry the nutrient-poor, carbon dioxide-laden blood back to the placenta so that we can exchange waste products for nutrients and carbon dioxide for oxygen.